Welcome to the Fearless Aging Podcast, where we interview top mind, body, and spiritual wellness experts, give you proven tips and strategies that you can implement immediately to greatly improve your overall health and well-being so you can avoid disease in old age and live an energetic, vital, long life.
Hello, I'm Rico Cavella, creator of the Ageless Living Lifestyle. If you are concerned about premature aging and you want to avoid disease and old age and you want to live a more healthy, energetic, and vital long life, I have proven solutions for you. So number one, go to agelesslivinglifestyle.com and take our aging quiz to see how well you are doing. And number two, book your free coaching session with me to discuss your wellness challenges, and I promise to get you going on the right track. You can transform your health and your life, and I can help. Hello, this is Rico Cavella, and this is your Fearless Aging Podcast, where in every episode, my guests and I, we strive to offer you proven tips and strategies that will greatly improve your overall health and well-being. And so you can live a much energetic and long life and go out and make a bigger difference in the world. So we're here to inspire you and empower you to become your best self. So before I introduce today's episode and our expert guest, I have a question for you. Do you wonder how well you are aging? Well, I have a solution for you. You can go to our main website, agelesslivinglifestyle.com, and we have an aging quiz there. So you can take the quiz and you can find out how well you are aging. And if you're not doing as well as you would like, I offer a free coaching session to hear all about what challenges you're having, and I'll get you on the right track to ageless living. So just go to agelesslivinglifestyle.com and you'll see the quiz right on the homepage there. So the topic of today's episode is the health and healing and anti-aging benefits of hyperbaric oxygen therapies. And this is a great topic. This is something I'm very interested in. I'm well aware of all the benefits. So our expert guest today is Amir Hadani. He's an MD and a PhD. He's the chief researcher and head of global clinic operations at Avid Clinic, which is in South Florida. Dr. Hadani is a certified neurosurgeon, hyperbaric physician, and chief medical research officer at the Segal Center. For the past decade, he has worked alongside Dr. Ifradi, researching neurorehabilitation, neuroplasticity, and physiology, and publishing more than 25 papers on the effects of what's HBOT, which is hyperbaric oxygen therapies, on cognitive and physical performance. He earned his MD from Tel Aviv University and his PhD in bioinformatics and machine learning from Bar Ilan University. So Dr. Hadani, thanks so much for being here.
Pleasure to be here. Thank you for having me.
Yeah, my pleasure. Well, let's start off by, for people not really aware of what hyperbaric oxygen therapy is, how about give us a definition of what it is and maybe a little bit about the history, how it came about, and then also how you got involved.
Perfect. Thank you. So hyperbaric medicine is, we can simplify it by going inside a chamber that's usually made of steel, closing the door and starting compressing air inside of it, making the pressure higher. So the atmospheric pressure is higher around us, and then breathing 100% oxygen. So basically, we're breathing very pressurized oxygen. What it enables us is to dissolve more oxygen into our blood or our plasma. Think about it like a Coca-Cola can. When we have pressurized carbon dioxide inside the Coca-Cola, so in the Coca-Cola fluid, we have carbon dioxide. In the hyperbaric chamber, we have pressurized oxygen dissolved in our plasma or blood. And that enables us to trigger marvelous processes if you're using a very specific technique and repeating this exposure in a very specific protocol. And I guess to answer how did I get into this, so I was a neurosurgery resident, like you mentioned, and I was in connection with Professor Sharfradi, who was my mentor in med school, and he has started telling me about several neurological cases that are improving with exposure to hyperbaric medicine. And I couldn't believe it, but I'm a very skeptical guy. I'm a very scientific guy. And I told him I have a couple of cases from my residency, different traumatic brain injury cases and stroke patients that I was treating, and we put them in a clinical trial, randomized clinical trial, and so they improved. And the effects were simply amazing, both cognitive as well as neurological motor deficits. My own patients, and the rest is history. We started randomized controlled trials and a clinical program for that that got me involved really. And since then, that's what my main focus is in.
Wow. Yeah. Well, I'm familiar too. Like we were talking earlier, I have some friends who have experienced that. Like say, I had one friend that his child had leukemia, and he said when he started getting some hyperbaric oxygen therapy, it made the much bigger difference than any other kind of medical attention that they received. So, how long has this been around? What's kind of the history? Who actually developed this?
So the history of hyperbaric medicine, I guess, goes back almost 100 years ago, when we're talking about hyperbaric exposure being treating divers. So
Oh yeah.
diving medicine, people who are diving in the wrong way and having different diving accidents and getting something we call the bends or decompression sickness. So the only treatment is basically putting them in a hyperbaric chamber.
Mm.
Then people realized it actually can improve healing, and it was being treating different non-healing wounds, such as diabetic foots. So people with diabetes who have wounds that do not heal by any other means, we put them in hyperbaric chambers, and we improve their healing. But then the whole neurological aspects, that's a pretty recent finding led by Professor Shai Fradi, myself in Israel, when we initiated these randomized controlled trials that pushing different neurological indications. So what we found out that if you do a specific protocol with hyperbaric medicine in a very unique way of how you do the repeating exposures and what specific protocol, you are able to improve healing of the brain.
Mm.
So if you have a specific wound in your brain and you do this specific protocol, you are actually improving the healing of different wounds, such as stroke, such as TBI, such as cognitive decline related to aging.
Oh, yeah, that's so impressive. Well, before we get into that, actually, I'm really interested in what the real protocol is and what particular specific uh, uh, ailments and that it really works well for. But just to get just a little more clarity for our audience, isn't it true? Our basic atmosphere is what, around 20% oxygen, right?
Right.
Is that
We're
about
in
right?
about 21%
Right.
oxygen.
And I don't think it's any secret how important oxygen is. You know, we have to get oxygen to breathe. But tell us a little. Okay, but so when you actually are breathing, is it almost like you're breathing 100% oxygen, or?
So inside the chamber, we're breathing 100% oxygen, but at a higher pressure. So it's much, much more than 100% actually.
Yes.
If you're thinking about the physics of it, like I said before, we're dissolving much higher number of molecules of oxygen inside the blood. So think about it, much more than 100% oxygen, because you're doing it at a higher pressure level. And I really like the example you gave, that how we know how important oxygen is. We actually try to realize how important that is. And a couple of years back, we did a study on that. We took young students from a very good university in Israel, and we divided them into two groups. And half of them were doing a task inside the chamber, and half of them were doing outside the chamber without oxygen and pressure.
Mhm.
And we were asking them to do a questionnaires in one hand, and in the other to put beads in a box. You had to do some manual dexterity in order to do that,
Mhm.
and you did it in the same time. So very complex task, dual task actually. And surprise, surprise, the people that have the group that was exposed to hyperbaric pressure and hyperbaric oxygen did significantly better.
Mhm.
And the reason is exactly what you said. Oxygen is driving our brain. It's so important to have higher level of oxygen in order to perform well. And that's only to perform. I'm not talking even to repair. To repair things, you need even higher level of oxygen.
Would you agree that most fatigue and most pain in the body is lack of oxygen in the body?
Definitely, a lot of the different pathologies and diseases are run by lack of oxygen. A lot of times, inflammation is related there, but it comes down to different cells and different organs suffering from lack of supply of blood and eventually lack of supply of oxygen,
Mhm.
lack of energy, and the actual symptoms and signs that we see.
Yeah. Well, and that's what aerobic training is all about, is training your lungs and your bloodstream to get more oxygen into the bloodstream. And that's what aerobic training, that's what the training effect is, right? When you run out of oxygen, then you can't keep running or moving or whatever you want to do. And so one who has a better aerobic capacity has trained their lungs to take in more oxygen and be able to utilize more oxygen out of the bloodstream.
Perfectly right. So what you're talking about is getting to the point of anaerobics where you
Mhm.
stop utilizing oxygen and you're starting to become anaerobic. That's when you feel the pain in the muscles.
Mhm.
That lactic acid is burning your muscles because you're not utilizing oxygen anymore. That's the suffering. That's when your body says, stop, I cannot go any further. So definitely we know that when we have lack of oxygen, our organs starts to deteriorate and do not function as they should.
Absolutely. Okay. Well, my next question is, though, we also know that more always isn't good, and we can always do too much of one thing. So what is it? Is there any danger of getting too much oxygen?
So yes, what you're referring to is something we call oxygen toxicity. And definitely if you do a dangerous protocols of oxygen, you can run into troubles.
Mhm.
And a good example, for instance, we learned from young babies, who, for instance, who are preterm. If we expose them to too much oxygen for a long time, they will suffer from oxygen toxicity.
Mhm.
If you do the wrong protocols and do it in the wrong way, in the wrong chamber, you can actually do damage. So what you want to do is to utilize a safe protocol that will not damage your brain or your lungs. Because definitely too much and not done properly, you can cause seizures, which is, lose consciousness and have shivers like epilepsy.
Uh,
You can actually induce that with too much oxygen. You can cause deterioration in your lungs. But again, the real thing is to do it by a professional who knows what they're doing and doing it with the right protocol. And I guess on that end, there are a lot of different chambers out there. People are doing it by their own at home, and different providers are supplying this. That's the danger of this. If you're doing it by yourself without a certified technician that will keep your lungs and brain in the right spot with the right protocol, you are endangering yourself. And on top of that, there's also the risk of fire. We are dealing with oxygen, and we know oxygen can burst into fire. So you do want to make sure someone is keeping an eye on you and keeping you safe and not jerry-rig the whole thing,
mm,
putting yourself in danger.
yeah.
So regardless of how you get it, do it safe and right.
Okay. Yeah. Well, before I want to ask you, how you determine your protocol and what it is, I just have one more question is, we're all familiar with hyperventilation when we just breathe too much and we get, so what's going on there? When we're just like breathing too much and all of a sudden you get like lightheaded or what's called hyperventilation. What's actually going on there?
So when we hyperventilating, we're actually decreasing the level of CO2, the carbon dioxide.
Yeah.
When you're hyperventilating, you're not really doing anything to your oxygen, but you're actually working on your CO2 levels. And at a certain range of it, it can actually affect dizziness and those lightheadedness when you're dealing with your CO2 levels. It doesn't have to do with the oxygen.
Oh, okay. That's good. That's good to clarify that. All right. Well, one more thing before we get into it. Tell us well, you already mentioned like brain health and healing, a lot of different things, but talk a little bit more about what specific diseases or ailments or chronic things that it's really has worked really well for.
Okay, great question. So first of all, every condition that we have researched, we wanted to learn the pathophysiology behind it. We wanted to make sure that it has specific dynamics of a brain wound, that we are able to see a wound in the brain that will react or respond to hyperbaric medicine. And so I guess the first one that we started off was stroke. Stroke patients suffer both from a neurological deficits such as motor or sensory deficits, paralysis, I guess in a layman term, speech deficits, and obviously cognitive deficits. We know today half of stroke survivors are suffering from cognitive deficits like memory, attention. So that was the first indication that we have treated and showed great response both on motor as well as cognitive effects. The next one was traumatic brain injury. And we're talking about there's a spectrum of what we call traumatic brain injury, starting from concussion that is so common today with motor vehicle accidents in sports medicine, all the football players, whether they're elite level or even at the playground playing football. Concussion is very, very common, and a minority of the cases can suffer for chronic cognitive symptoms for the rest of their lives. So many movies have been made on concussions, obviously. But it goes all the way to traumatic brain injury in the military, in different vehicle accidents, obviously, with significant, severe damage to the brain that requires operations. Again, we saw the same brain wounds or metabolic wounds that we see in the brain that can respond to our protocol. And again, we're talking about different motor deficits as well as cognitive deficits that improve. And really, I must stress here that both of them, these indications we talk about even in the chronic conditions. So if someone had a stroke even years ago, and we are able to analyze that brain wound, it can still respond to the protocol. It doesn't have to be, okay, I had the stroke last week, only then it's relevant. It can also work years after the actual condition or injury.
Wow, that's great.
So those are, so again, stroke, TBI. Then we also, part of the traumatic brain injury patients were actually fibromyalgia patients. A lot of time there is a connection between traumatic brain injury and fibromyalgia, as well as PTSD. So we also did randomized controlled trials in fibromyalgia and PTSD patients. Recently, we also completed the long COVID symptoms. We found out that the long COVID syndrome that all over the news, unfortunately, in the past 3 years, shows similar symptoms and similar brain wounds when we analyze it in our imaging. and we are able to treat long COVID syndromes. And so those are kind of the indications that we are focusing on. And I will stress again, it comes down to do the right imaging and the right way of looking at the brain and looking at those brain wounds and see if it makes sense to treat. So it's really, really important to do the right patient selection and making sure the patient is eligible for this treatment. And that's, again, the indications. And eventually, it led us to do our aging trial. We know today that we have both physical decline as well as cognitive decline related to age. And we can have, I guess, another hour to discuss whether aging is a disease or not. But regardless of where you stand on that, we know that those physical and cognitive decline occur. And again, if we are able to do that analysis of imaging, we are able to see if we can help with this cognitive decline as well as physical decline related to aging. We did a randomized controlled trial on this and showed we are able to actually reverse and slow down the aging process.
So have you worked with people with Alzheimer's and dementia?
So Alzheimer's and dementia is, I guess, the end spectrum. Sometimes when it's fully blown Alzheimer's disease, a lot of time it's too late, I would say. There's not enough brain matter and brain tissue that we can reverse. We can reverse, but the clinical effect would be too little to have clinical effect. So we want to have patients on the spectrum of Alzheimer's much earlier, when the symptoms only begin or at the early stages rather than at the late stages. It's very, very hard when we're all the way out there.
Wow. What about some more common ailments that are not necessarily totally connected to the brain? Like I mentioned, my friend's son who had leukemia got some really good results. And then what about things like that, like blood diseases or cancer or diabetes and those sort of things?
So for cancer per se, I would say that the evidence we have today about hyperbaric medicine, we do not see it will affect the disease. It will not make it worse. It will not induce cancer or anything like that. But we do not have data to support that it will improve the cancer itself. It can improve the effects of the treatments. Let's say radiation injury, if the patient had radiotherapy because of the cancer, then we are able to treat the wounds that the radiation caused or the chemotherapy has caused, but not the cancer itself.
Okay.
So we are able to improve these patients' physical abilities and cognitive abilities, but not the cancer itself. As for diabetes, we know that all of these conditions are related with lifestyle. And part of what we do in our Aviv clinics is the core is hyperbaric medicine, but on top of that, we also augment it with physical training and nutrition coaching and cognitive training, which can definitely have significant effect on those classic conditions, as you'd say, obesity, diabetes, hypercholesterolemia, atherosclerosis, heart disease. All those conditions we are able to help significantly just by lifestyle changes. And when you combine it with our hyperbaric protocol, you get significantly better results.
What about healing physical injuries? Like if you tear muscles or ligaments or connective tissue, can that be helpful for that, for healing physical injuries?
Yes. So we do know, like we talked about, we know that the certain protocols that we are doing here are increasing or augmenting wound healing. And any tendon that has ruptured or disconnected, we are able to increase the healing of it. So if something would take 6 months, for instance, we can shorten that time significantly by exposing it to our protocol.
Great, great. So interesting. And thank you for all that. It was so well said. Okay, so let's get into how you develop your protocols and what is your protocol?
Okay, sure. So our protocol is evidence-based. So what we had to do is design a randomized controlled trial, do specific number of sessions at specific pressure and exposure to oxygen, and test it out and test it compared to a placebo group. And only when we found out that there was a significant difference between the ones that were exposed to this group, to this exposure, and the ones that were exposed to a placebo, which was just air at normal pressure, that's what we found out as our classic protocol. Now, what I want to stress is this protocol is not just doing oxygen at high level of pressure, but actually doing fluctuations of that, meaning that we're in high pressure, breathing 100% oxygen, and then after several minutes, we're doing a break, and then we're just breathing normal air at higher pressure. What it causes is those fluctuations in the oxygen that we're breathing. So we're at high level of oxygen, normal level of oxygen, high level of oxygen, normal level of oxygen through the entire exposure. That's what.
I'm sorry. I was just going to say that's kind of like interval training, aerobic interval training. Yeah.
Perfect example. That's exactly it. We call it oxygen fluctuations, but interval training, I'll take it. What we're doing is exactly that. We're doing interval training to our cells, and more specifically in an organelle inside our each cell called the mitochondria. You know, athletes are really, really concerned about how their mitochondria are working. That's the organelle that's producing energy. That's how we survive, how we do anything in our body, using taking oxygen and making it into energy. So we're doing that interval training to the mitochondria. And by doing that interval training, we're increasing the function of it significantly. It's exactly like training an athlete, but training the mitochondria. So we developed this unique protocol of doing it 60 sessions. We are doing 60 sessions daily. So it's 12 weeks, 5 days a week. Each time it's 2 hours. We're doing it at specific pressure with 100% oxygen. And we're doing those oxygen fluctuations, again, using our protocol. I don't know if we're going to go into the details of this, but basically, again, this protocol is what we used and found with our clinical trials. And then with each clinical trial, we test it out. We test out that this specific protocol is able to work on a specific brain wound.
So you're saying, now I know it depends on how many treatments you need depends on what you're dealing with. But so are you saying that you need to do it 5 days a week for how long? You said for 12 weeks or something like that? Yeah.
Yeah, we're talking about a long period. If we're talking about healing the brain, if we're talking about cognitive decline of aging or a stroke or a TBI, again, brain pathologies, it takes 3 months. It takes 12 weeks to do that. And the reason for that is what we're trying to do is repair the brain. And the brain is a hard organ to treat and induce the repair in it. And that's why it takes time. What happens in that time, we are recruiting stem cells and we are building both new nerves and new blood vessels in the brain. That takes much longer time than to heal a to heal a hand wound or a leg wound or even a tendon. So if you asked me before about those tendons for athletes, on there, we do it much shorter periods of time. But when we're dealing with brain repair, we need 12 weeks.
12 weeks. Well, I was going to ask you to talk about why, HBOT hasn't, caught on more and it's not more mainstream. course, I know there's lots of reasons, but one of them obviously is the cost then, because I know it's a little bit rather expensive, and it's unfortunate that most insurances still don't pay for it, right?
Yeah, so I guess why hasn't it caught on more? I think research is just starting. So we've been doing there for the past 15 years, but it's pretty early end 15 years in research.
Okay.
But we're picking up the pace. We're picking up the pace, and we're growing more evidence, and eventually it will become part of insurance. It just takes time to
Yeah.
convince all those insurance and governmental authorities to approve it, but it will happen.
Yeah.
Um, but I would say that the big problem is to do it responsibly. Um, you have to do it the right way for the right patient and to do your patient selection. You cannot just say, all right, this is the protocol, let's do it for everyone. No, this is the wrong attitude. You have to do it safe and you have to do it right, like everything we do in medicine. It's a medical intervention. You have to do the right protocol, just like you do with any medication, any drug, any surgery. You cannot do everything for everyone. You have to do the right things for the right patient.
Well, what would you say would be a protocol, an anti-aging protocol? Would that be something you could just do like consistently on a regular basis, but not so intense, like like you have to do it every day? Or
So that's what we tested out. So that's what we wanted. And when we did our aging trial, that's exactly what we wanted to find out. And again, we had to select the patients that we treated. Again, imaging-based selection. And the protocol, we found out that proven efficacy was 12 weeks. We wanted to repair the cognitive decline related to aging.
okay.
Again, induce stem cells, induce new blood vessels, and that took time. It took 12 weeks, and we saw remarkable results at the end of the trial. And 6 months later, we saw these effects last. However, obviously, we still need to know how fast do you need to repeat it eventually, because aging continues, obviously, eventually. So after several years, we are expecting that aging will happen at a slower pace, but it happens, and then you repeat the process.
Well, can you talk a little bit about the cost? I know the cost is a little bit, prohibitive for most people, especially if you have to do that long of a time. So what can be done about that? Because obviously most people are not able to afford that much treatment.
So again, I'm not really representing the financial part of it as the science and physician here. But
Okay.
yeah, the cost, since it's completely out of pocket, like and again, 12 weeks of intervention, and it's a
Yeah.
very comprehensive program. Like I said, it's composed of both the hyperbaric protocol, nutrition coaching, cognitive training, physical
Oh,
training.
okay. Okay.
The cost is up to $50,000, and it's definitely significant for a lot of patients. But again, you need to eventually ask yourself, what are you spending on your healthcare and on your aging process, for
Yeah.
sure.
Yeah. There's no question about that. Uh, what about these? I know there's some places that have these just little portable ones you go in. Are those things of any benefit or not? Those portable ones where you sit in with your head still out and you just sit in there. Are those any of value or not?
So the ones that your head is out
Yeah.
actually are meaningless. I would
Yeah. Yeah.
greatly say that as bold as I can. The one that, if you're not inside the chamber and it's not completely sealed, that's not hyperbaric oxygen at all.
Okay.
It's like local oxygen therapy. It doesn't
Yeah.
do anything about the processes in your body. Now, the ones that there are those monoplaces that you are inside of a capsule.
Yeah.
Um,
It's like we go like to get an MRI. You go inside of a capsule, right?
right, but that capsule is completely closed. So
Yeah.
there are those chambers. The
Okay.
problems with that is, like I mentioned earlier, one, safety. Again, those things explode. If you look at the hyperbaric medicine history, those
Mhm.
things are exploding every couple of years. and the patient inside pays a severe price for that. That's number one, safety, and number two, efficacy. Most of these chambers cannot do the protocol that we have proven scientifically. They cannot repeat the way that the pressure that we're doing, the level of oxygen, and those oxygen fluctuations. Those chambers cannot do it physically. So both safety and efficacy makes those chambers a bit less appealing.
Okay, so well, tell us how people can find out about your clinics. I know you have what's called the Avid. Is that what it is? Avid clinics. You're in Florida. Do you have clinics in other states as well, or?
Right. So Aviv, we were spread out. We have one in Israel and one in Dubai, in Asia. And now we're here in Central Florida. You can reach us at aviv-clinics.com, www.aviv-clinics.com. And anyone who's interested can reach out and we'll provide consultations if this is suitable for you or not. People should feel free to contact us and tell us about their medical history, and definitely we'll try to help the best as we can. And next year, we'll be also opening a center in New York City, right in Midtown, Manhattan. That will be our next clinic as well.
Okay. Yeah, so we'll put that address, how you can find Dr. Hadani's clinic. We'll put that in the description of the show. Well, what would you say to people like, I mean, there's some hyperbaric clinics here in San Diego. So how would one go about determining whether it was, they were doing a safe and effective protocol?
It's a great question. I don't know a lot of the other chambers. Usually they are unable to replicate our protocol, and they are unable to provide a comprehensive program like we do. It's really important to actually have a scientific-based protocol, and not just do something that you think that can work, but actually work based on science, based on data. What we have built is, again, evidence-based comprehensive protocol. People definitely are shopping around and looking into the chambers, but really important to find out what's the protocol, and they can reach out to us and ask us what do we think about it, and compare what we do. But I think also the other more important part of it as well is the patient's evaluation. I think again, I have to stress is how do you assess patients? How do you select them for the treatment? How do you ensure that these people will benefit from the protocol? Do you do the appropriate cognitive analysis, imaging analysis, physical analysis before you start? If you don't, you're not doing medicine. You're just doing something else.
Yeah, very well. Well, that's so well said, and I really appreciate your information. I really appreciate what you guys are doing. You're offering a great service, and hopefully, it'll be covered by insurance pretty soon, so a lot more people have access to it. Because I know it's going to be a real help in healing so many people, and we have so many challenges these days that we need more things, therapies like that can help people out. So, yeah, I really commend you for your great work, and yeah, let's hope that we can get it out there to the mainstream people a lot sooner. Yeah,
it's definitely our goal. So we're working with all the parties involved and promoting science and more randomized controlled trials to help it eventually be spread out for sure.
Very good. Well, Dr. Hadani, thanks again. Thanks so much for your work, and thanks for being here. That was really informative. I really enjoyed it. Thank you very much.
My pleasure. Thank you for having me.
Yeah, thanks for get that information out. So if you enjoyed today's episode of the Fearless Aging Podcast, be sure and give us a review and subscribe to our channel and let people know about the Fearless Aging Podcast. And like always, I say, we always offer you some great information. And so, but knowledge without action is useless, right? So you've got to take action on what you learn. So step up and take action and go out and make it a better world for all of us. Thanks again, Dr. Hadanny.
Thank you.